Thank you, dear Chairman. Good afternoon, colleagues. Today I have the privilege to share lessons learned and best practices from hepatitis C elimination program of Georgia. It's not moving. I have nothing to disclose. Very briefly about epidemiology of hepatitis C in Georgia. The initial survey on hepatitis C prevalence was conducted in Georgia before the launch of hepatitis C elimination program in 2015, which showed that 5.4% of Georgia's adult population had chronic hepatitis C. In 2021, Georgia, we repeated seroprevalence survey on hepatitis B and C in collaboration with CDC Atlanta, and within these 6 years, the prevalence of chronic hepatitis C has decreased by 67% from 5.4% to 1.8% in 2021. And everybody can agree that this is a remarkable progress of our program and gives us the hope that hepatitis C elimination can be achievable by the end of 2025. So the program was launched in 2015 with the technical support of US CDC and commitment of Gilead Sciences to donate free of charge DAAs. Gilead provided Georgia with sofosbuvir, ledipasvir, and velpatasvir sofosbuvir free of charge. The program aims to diagnose 90% of all persons with chronic hepatitis C, to treat 95% of those diagnosed, and to cure 95% of those on treatment. The main hallmark of our program is that the program builds on delivering a comprehensive response, including nationwide HCV screening, treating, including retreatment of all persons, active case finding, public awareness and education, blood safety, harm reduction, infection control, surveillance, etc. So this is the timeline of key activities under the program. As I mentioned, the program was launched in 2015. In 2017, we decentralized HCV treatment and care services at the level of primary health care and harm reduction, and currently many sites in different locations across the country provide simplified HCV care and treatment services in primary health care and harm reduction settings. We piloted a project in 2018 to integrate HCV, tuberculosis and HIV at primary health care level. In 2020, we launched the Linkage to Care program for identifying those who were lost in HCV care cascade and to link them to the care. In 2022, Georgian National CDC was designated as the WHO collaborating center on viral hepatitis elimination, and our experts are permanently conducting training sessions and workshops for our neighboring countries to share best practices from our program. And the great news is that this year, Georgia also launched national hepatitis B program, and all services related to diagnosis and care for patients with chronic hepatitis B is funded by the national program, and it is free of charge for everyone. This is the HCV care treatment and care cascade by the end of March 2024. More than 2.8 million persons have been already tested. 107,000 persons had chronic hepatitis C. We already treated about 87,000 chronic hepatitis C patients with 99% cure rate, but you can see that about 19,000 persons who have positive antibodies, they are not linked to confirmatory testing, and another challenge is that about 40,000 persons with confirmed chronic hepatitis C, they have not initiated treatment yet. We are also close to micro-elimination of hepatitis C among HIV, HCV co-infected persons. and prevalence decreased from 27% to 4%. It's about 85% reduction. Reinfection rate is about 2.5 per 100 person years. To summarize best practices from Georgia's hepatitis C elimination program is that the program has electronic registries to collect real-time data for testing and treatment progress of the enrolled individuals, integrated TB, HIV, and HCV screening programs at primary healthcare and harm reduction centers, point-of-care viremic testing and initiation of HCV treatment are free of charge and widely available in many locations of the country. We significantly improved and accelerated and improved infection prevention and control interventions in both medical and non-medical facilities. And as for blood safety, all screenings are using nucleic acid testing. Also, our program is supported by a technical advisory group which consists of 12 international renowned and leading specialists, and they are permanently monitoring success and the progress and challenges of Georgia's program, and they are giving recommendations how can we improve and can overcome the existing challenges. So the main challenges and next steps are to strengthen linkage to care, to identify these 20,000 persons who are not enrolled in treatment yet, to strengthen infection transmission prevention in general population as well as in target populations. Georgia is applying for the validation of path to hepatitis C elimination, and of course raising awareness on hepatitis B and C should be on political agenda, and the government of Georgia is committed to accelerate interventions and accelerate this awareness raising. And within the hepatitis B treatment program, which has been launched recently, we have to increase hepatitis B vaccination coverage, not only in key populations, but for adult general population. In September 2022, Georgia was invited at the United Nations side event, Solidarity for Hepatitis Elimination, and Georgia, together with Egypt, called and invited all member states to join formation of the UN Charter, so-called Group of Friends to eliminate hepatitis. Finally, I would like to acknowledge all partners enrolled in Georgia's hepatitis C elimination program, and thank you for your valuable attention.
Thank you. Thank you, Dr. Abutit.